Nurse Nuru has become comfortable using her tablet, communicating on WhatsApp, and submitting reports through DHIS2. But today, her facility introduces another digital health system. She freezes. Do I really need another system? If you ever felt that way, this episode is for you. By the end of this session, both Nuru and you will understand what digital health really means. Welcome back to our Digital Literacy for the Health Workforce series. Today, we are beginning Module 3 on digital skills in practice. This module moves beyond using digital devices to understanding the digital systems that support healthcare. Let's continue following Nurse Nuru's journey. By the end of this episode, you should be able to define digital health, recognize the different types of digital health technologies, understand key concepts like interoperability and health information exchange, explore the WHO enabling environment, and assess digital maturity using the Africa CDC framework. Let's get started. Meet Nurse Nuru. Her digital journey has already begun. She has developed digital literacy and is becoming digitally competent. Now she's asking a bigger question. How do all these digital systems fit together to improve healthcare? Today's session will answer that question. Nuru initially thought digital health is simply using computers or devices in healthcare, but she quickly discovers it's much broader. According to the WHO, digital health is the field of knowledge and practice associated with developing and using digital technologies to improve health. In other words, technology is only the tool. The goal is always better health outcomes. As Nuru explores further, she realizes digital health involves many different technologies. E-health, secure cost-effective use of ICTs to support health and health-related fields. M-health, front-end, client-facing mobile applications and services. ELMIS, electronic logistics management information system, tracks medicine supplies and stocks across the supply chain. Telemedicine, healthcare provision at a distance via ICT. Lab information system, records, manages and stores lab data. Health information system, integrates data collection, processing, reporting and use to improve health service efficiency. Internet of Things, connected devices and sensors generating real-time patient data and environment health data. Big data, large complex data sets analyzed for patterns in disease, behavior, and system performance. AI, machine learning that can diagnose, predict, triage, and personalize interventions at population scale. Each serves a different purpose, but together they strengthen health service delivery. Next, Nuru learns several concepts she'll encounter throughout her digital health journey. Digital health standards. These are agreed technical specifications enabling systems to communicate and exchange data reliably. They include terminology services, FHIR for data exchange, and ICD-11 for disease coding. Interoperability. Different systems exchange and use each other's data without custom connectors. This is the gold standard. Health information exchange. Electronic sharing of health information across organizations while maintaining data security, privacy, and accuracy. HIE makes patient data follow the patient, not stay trapped in one facility. Shared services. These are reusable digital infrastructure shared across all health applications, eliminating duplication. Each app should use this, not build its own. They include client registry, facility registry, provider registry, shared health records. Enterprise architecture. This is blueprint aligning all digital systems, data processes, and technology with strategic health goals. It has 4 layers: business, service, applications, and technology. Digital public infrastructure. DPI is foundational shared digital systems built for population scale, including patient ID, payments, data exchange, health DPIs, and a PIN UHC service delivery. Digital public goods. These are open source software, data, and standards advancing equitable digital development at no cost. They include DHIS2, OpenMRS, OpenHIE, IRIS, among others. Together, these create unified and connected health systems rather than isolated applications. WHO Digital Health Enabling Environment. Nuru realizes that technology alone is not enough. Successful digital transformation depends on several building blocks. WHO provides 7 pillars for a digital health enabling environment. 1. Leadership and governance. This is political commitment. 2. Strategy and investment, including national digital health strategy and costed implementation plans. 3. Legislation, policy, and compliance. This includes data protection laws, policies, and frameworks. 4. Workforce and capacity. These are digital competencies across all cadres. 5. Standards and interoperability. This is adoption of national standards. 6. Infrastructure and connectivity, including power, broadband, and devices access. And 7. Service and applications, the digital tools health workers and patients use, including EMRs, HIS, telemedicine, ELMIS, ECHIS, and so forth. If one component is missing, the whole system becomes weaker. The Global Digital Health Monitor is a self-reporting tool completed by countries through a national multi-stakeholder process. It fosters country ownership, supports evidence-based planning and investment decisions, enables benchmarking, and tracks progress over time. The 7 pillars we discussed in the previous slides are assessed across 5 maturity levels. Level 1, emerging. Digital health activities are limited, fragmented, and in early planning stages. Level 2, developing. Foundational digital health initiatives exist but remain inconsistent. Level 3, established. Digital health systems and governance structures are operational and expanding nationally. Level 4, advanced. Digital health is well integrated into health systems with strong coordination and interoperability. Level 5, optimized. Digital health is fully institutionalized, data-driven, sustainable, and continuously improving. Most African countries sit at level 2 to 3. Workforce mostly scores lowest either at level 1 or level 2. It is also most underfunded, and yet it is the most foundational. Africa CDC Digital Transformation Strategy 2023 to 2030. Finally, Nuru discovers the Africa CDC Digital Health Maturity Model. It helps countries and health facilities measure progress across 10 building blocks, which include leadership and governance, strategy and investment, legislation and regulation, workforce and capacity, standards and interoperability, infrastructure and access, services and applications, data use and analytics, change management, learning and adaptation. You realize that most of these map onto the WHO's Global Digital Health Monitor. It's a self-assessment maturity scale from 1 to 5. From 1, absent, no evidence. 2, emerging, fragmented, donor dependent. 3, established, systems exist, uneven coverage. 4, advancing, national coverage, M&E in place. And 5, optimizing, evidence-driven global standards. Nurse Nuru mentioned that they recently scored their facility on each building blocks. We are at level 2 of workforce and level 1 on data and evidence. Most countries are still building their digital health capabilities. The most important thing is continuous improvement. Every step forward strengthens the health system. Before the quiz, take 60 seconds to pause and reflect. Nuru's journey in this episode. She started confused by a new system, learned what digital health is, understood the ecosystem. She can now assess a facility and advocate for what it needs. Where is your facility or country on the W-enabling environment? Which of the 7 components is missing? Which of the 9 digital health technologies does your facility actually use and which are absent? If you had to score your facility on the Africa CDC 10 building blocks today, which block would score the lowest? Drop your answers in the comments below. Your reflection helps the community learn. Let's test your understanding with 3 questions. Question 1. According to WHO, digital health is best described as A. Having smartphones in every facility. B. The field of knowledge and practice associated with digital technologies to improve health. C. Using the internet to book appointments. And D. Social media for health education. Question 2. What is the key difference between interoperability and integration? A. They are the same thing. B. Integration uses open standards. Interoperability uses custom connectors. C. Interoperability allows systems to exchange and use data without custom connectors. D. Integration is always better for African systems. Question 3. Most African countries currently score at which level of the Africa CDC digital maturity scale? A. Level 1 absent. B. Level 2 to 3 emerging and established. C. Level 4 advancing. D. Level 5 optimizing. Take a few seconds to answer the questions and I'll provide the answers shortly. Here are the answers. Question 1. The correct answer is B. The field of knowledge and practice associated with digital technologies to improve health. Question 2. Interoperability allows systems to exchange and use data without custom connectors. The answer is C for question 2. Question 3. Levels 2 and 3, emerging to established. We have come to the end of episode 10 on Introduction to Digital Health. Next week, we shall look at using data for decision making. Nuru knows what digital health is. Now she needs to use health data to make better decisions for our patients and community. Subscribe so that you don't miss episode 11. Drop a question about data in the comments. Share with a colleague who works with health data. Thank you for watching. The journey continues from digital literacy to digital dexterity.